Welcome to Medical Confessions,
your remedy for serious medicine. I'm Jen.
I'm April.
And I'm Scott. Today we're going to be talking about erectile dysfunction. A little disclaimer, if you have kids in the room, you should probably remove them, or this is definitely not safe for kids because we're going to be talking about male genitalia and joking about it. So
there's a lot of rabbit trails that this one led to when I was doing my study. I don't know about the rest of you, but
or just be prepared to have a very open conversation.
Correct.
Parental discretion advised.
That's right.
I think is what they say.
Awesome. So, erectile dysfunction, ED, also known as.
Exciting.
Yeah,
Not.
I don't think it is actually.
Not exciting at all.
So, what is it?
Well, you can't get an erection.
Right.
Basically, that's it.
That sounds pretty ominous.
Erectile dysfunction, yeah. That does sound ominous.
Yeah. I feel like it's one of those things that just kind of a blanket, just a general term, but it looks to me like it could be caused, or there's lots of reasons that a person might have difficulty gaining or maintaining. Now, erectile dysfunction just means, in general, you may get one, but you can't maintain it?
Well, it's you can't maintain an erection hard enough for sex, basically, is the definition. Some people it's, very specific to one time. It only happens once. Some people it happens all the time. But at the end of the day, I'm surprised at how common it is. But whether it happens once or twice, over a given period, or it happens to you all the time, you just can't get it ever.
Yeah.
Which would really be unfortunate.
Well, in 1998, it was actually the term impotence was redefined as erectile dysfunction. So erectile dysfunction didn't actually come to the general population until 1998.
It sounds a little more palatable than impotence. Impotence sounds like, I have what? Cancer? What?
Yeah, well, I think it sounds kinder when you say you're impotent. But your erectile dysfunction sounds kind of mean.
Well, the other way, impotence seems very negative to me.
Well,
I like erectile dysfunction. It sounds more medical.
Yeah.
It sounds like I have something wrong with me, like a disease.
Well, isn't it? Isn't it?
I think it's a debilitating disease. It's never
horrible.
happened to me, but if it does, I'm going to be a little,
And you're how old?
I'm 41.
Okay, so the statistics for based upon age is pretty scary, right? So I think at 20 it's about 8%, correct? And then like in your 30s it's 12%, so kind of minor. So 20s and 30s you're good, and then all of a sudden you jump up to 40 years old, and now you're bumping up into
40s%?
Not quite. I think it was in the 30s.
Was it?
But then it looks like every, decade later, it goes up by 10%. By the time you're like in your 70s, it's not good.
Like 68%
just
or something.
don't even bother.
It's like 1% a year.
So you say it's common, but it's not common in younger men. And I say younger all the way up into your 30s. It's not common. By the time you're in your 40s, now it starts to appear more frequently.
Yeah.
So what are the reasons that people would have impotence?
Impotence, ED. Well, and it is true. 90% of the reasons are medical. The other 10% is going to be psychological stuff, which, I guess you're scared to get an erection, or you're just maybe uncomfortable in the situation.
I would feel like it would be a compounding problem. Like, if you're in a bad marriage, and women tend to be more emotional with their sex drive, but is the husband not feeling fulfilled by his marriage, and then it causes friction and the sex life changes, and now it's even more stressful for them, so now they feel like they have to perform. I feel like it would be a really exaggerated.
Well, I do know someone who gave me the cracker philosophy that I don't know if we should talk about it, but he basically said, look, it's like this. This doesn't come from me, by the way.
This is a friend that gave you this.
This is a friend we all know, and since he touts this philosophy a lot, I feel like I can say it. He said,
you're not going to tell us who it is, and then one day he's going to start talking, and he's going to go, it's like the cracker philosophy, and then we're going to die.
So his philosophy was, it's like the perfect cracker, right? And in his mind, the Ritz cracker is perfect. The right amount of crunchy and soft and salty and
get
awesome.
On board with that.
And if you have the Ritz cracker, the perfect cracker, for 20 years, sometimes you just want a wheat thin. And that was his reasoning for perhaps maybe not
being able to perform.
I guess, well, this was the point of, if you're, having a bad time in your marriage, you're angry.
So he's using the metaphor of a cracker as a woman.
Yes.
Is women. So he's got a really wonderful Ritz woman, and now he wants a club cracker.
And now he wants a wheat thing.
He's going with the Cheez-It this week. Okay.
What is a saltine, then, I wonder?
I don't know. That doesn't sound good.
All right, we're digressing too much.
Ew. Triscuit.
What about the chicken and a biscuit crackers? Those are my favorite.
Parker loves that.
All right, back on topic.
90% of the stuff is medical, right? And so you can see the older you get, you're going to have a lot more medical problems, or your risk factors for ED are things that are basically medical problems that can affect erections. So blood flow problems. So anything like coronary artery disease, peripheral artery disease, atherosclerosis, which is, that excessive plaque in your arteries, all those are going to be risk factors, because if you don't have enough blood flow to the penis, then obviously you can't get erect. So blood flow problems, nerve problems, because, the beginning of an erection can be controlled by your central nervous system. So if you have nerve problems like diabetes or Parkinson's or MS.
Well, and would this potentially be a early or new sign? So, like, if a 40-year-old man all of a sudden is having problems and then suddenly is diagnosed with, like, Parkinson's or something like that, could that potentially be, like, an early... You're smiling, but I'm wondering, is it one of those things that all of a sudden it's a problem for somebody, but maybe they have this major medical...
Could that be the first sign that they have a problem?
Or maybe it's the first major thing, because I think a lot of people, when they start to have, like, MS symptoms, where they have kind of weird symptoms and they don't put it all together, but could that be one of those, like, kind of aha moments for somebody, like, something's wrong with me?
It could be. I mean, stranger things have happened for the that's how we found this cancer or that cancer, but
I just think that percentage that you're saying, the 90% is medical, that therefore if a male is having this problem, and especially a younger male, 30s, 40s, even maybe early 50s, if it's now happening, that's kind of a pretty big, like, eye-opener. There's something
else going on.
Yeah.
Well, and I smiled because since we're on this food analogy thing, I saw this thing the other day of people with Parkinson's, how much they miss soup.
Oh,
that's
terrible
sad.
joke.
That is sad. Well, I thought you were going on the food thing because we're all in the midst of beginning our diets for a future podcast, and so food, like crackers, sounds so good to me right now. I need a Triscuit if I had one.
I like my diet. I get to eat whatever I want, as much as I want. It's exciting.
Yeah.
Nerve problems.
Okay.
Diabetes, Parkinson's, MS. You can be on certain drugs for different things like high blood pressures, depressions, things like that. So digoxin is a cardiac dysrhythmia drug that you can take that can give you an increased risk of ED. SSRIs, which is like the most common antidepressant, comes with that risk factor. It's a big one.
That's really sad, because that would just create more depression, right?
I
More
would
anxiety,
think so.
more depression.
Well, and just looking at some of the studies that show the percentages of ED risk with SSRIs, that was one of the big complaints of people who get taken off of SSRIs. Sorry, guys, I hit my phone. It was ringing. Is that they weren't able to have sex, weren't able to get an erection, so they were like, "Doc, put me on something else," which makes sense.
Right.
Opioids, so any morphines, heroin. Vicodin, Percocets, things like that can cause an increased risk of ED. So, I mean, the older you get, the greater chance you're going to have all these medical problems, which also increase your risk of ED because of how they are affecting nerves and blood flow and things like that.
Well, and then behaviors as well. So you kind of mentioned opioids, but then I read, like alcohol, sleep problems, like all of these things that are all going to be connected. So if somebody is already, let's go back to the marriage thing, somebody's already struggling in their marriage, they drink more, they're sleeping less, there's more anxiety, like all of those things aggravate the ED. Intimacy is a big help to marriages to build trust and to feel, comfortable.
Fulfilled,
and so it's just kind of like a really slippery slope.
It is.
Maybe a bad analogy. So what about we talked about medical things maybe that are undiagnosed and stuff. What about people like with prostate issues, or like men that get prostate cancer and have their prostate removed? Mm-hmm. Does that still qualify then as erectile dysfunction?
It's a risk factor, because erectile dysfunction is you can't get an erection. Well, just because your prostate's removed doesn't mean you can't get an erection.
But a lot of men have that after having
their so that complication removed. Can exist. So it's a risk factor. Doesn't necessarily mean it will happen.
Yeah.
But, at the end of the day, the physical act of getting an erection and the inability to do that is the problem.
So here's another question for you then. When I was studying this, I read that you do not have to get an erection in order to have an orgasm.
That would make sense.
So can a man, even if they're suffering from erectile dysfunction, not still have happiness? Or is it more because they wouldn't maybe be able to fulfill their partner's needs as well?
I would imagine it's the partner needs as well. However, I don't know if I've ever read a study of people with a flaccid penis and the incidence of orgasm.
Yeah.
But I would think that because
back to he needs a study. Well, like, he just can't take someone's word. I need a study. What does that study look like, Scott?
That's what I was going to say. How do you get a bunch of flaccid men together and go, we're doing this, right? Like, I mean, to me that seems like porn at some point.
Yeah. Well, I don't mean someone but I mean there's probably people that have chronic erectile dysfunction, and perhaps they are still able to, within their relationship, have an orgasm, but maybe not what the general population would consider a full. They're not going through the whole process.
True. And how do you do that anyway? Like, if you're halfway through the study and you're flaccid and you're about to, climax, and then all of a sudden you do get hard, it's like, crap, now I'm out of the study, like. But would that be a good thing? Yay! I mean, I just don't know. The logistics of that study bother me.
Yeah.
Well, in the late 16th and 17th century in France, it was considered a crime to be impotent and grounds for divorce.
It's a crime.
How is that crime proven? Like, who decides that you've committed that crime?
Your wife.
No, I know, but what if your wife's a horrible person and just doesn't like you? What if she feels like she made a mistake and married the wrong man? Like, she's like, I'm going to ruin him.
I'm going to drag him through the mud.
And then is it just word of mouth? Like, do they just take her word for it, or do they make him prove it?
Well, so fun. I did. There's a book written by a lady in I think 2009. I forget the name of the book. I think it's where you're getting that from. She had mentioned there were court experts who would verify the impotence as grounds of divorce.
Do you go to school for that? And then how are they supposed to prove? How are they supposed to prove themselves in that scenario?
And who is the court expert? Is it the local prostitute then? Like, because they would be the experts in my mind, right? I mean, if you're going to have an expert, somebody who does it a lot.
Yeah.
That's prostitute in my mind.
I have to say that, like, somebody who studies history for a living, it's probably one of the most interesting jobs. Like, you could really dive into some of the stuff. We just laugh and make fun, but there's got to be, like, some pretty interesting morsels out there.
And do you have everybody leave the courtroom, too? Or does everybody get to stay and watch? Because that could be like, hey, I can't get an erection with everybody watching me, right?
Right.
That would make me nervous.
I just feel like there would be more to be worried about in that era than whether or not a man's fulfilling his obligations as a husband.
Well, and I guess if it was a crime, and were you sent to jail? Because then at that point, hey, what are you in for? Well, funny story.
That's embarrassing.
Yeah, it is.
It's pretty bad.
Not good.
Okay,
right,
back to ED.
Yeah.
So we talked about reasons, medical reasons. Mm-hmm. We didn't really touch too much on, is it physical or emotional reasons then as well?
Well, it's probably going to go back to how erections happen in the first place. Do you want to go over that?
Sure.
I mean, in general, we've talked about on previous episodes, I forget which one it was. I think it was How Erections Work, actually.
Yeah.
But basically, it's a blood flow thing that is mediated by so many different factors, and there's so many different types of erections, right? You can have nocturnal erections just in sleep. I think you were...
3 to 5 times they say a night, right?
That's exciting. Who knew, right?
Yeah. I mentioned it.
No
my
wonder
husband
I sleep on my
husband's
side.
like, well, yeah, of course. He was sure that was like serious, yeah.
How does that work for stomach sleepers?
I don't know.
I'm a side sleeper. I don't have that problem.
I guess it would also depend on size. Maybe.
True.
Maybe some aren't bothered if they're stomach sleepers. Others.
True. Yeah. Its average size was the what?
5.6 inches.
5.6 inches.
Yeah.
I smiled a little bit when I read that. For the record.
You victory dance.
Finally above average in something.
And we came across, there was a gentleman who's the longest known, correct?
Jonah Falcon holds the record for the largest penis at 13 and a half inches erect.
And he is definitely not a stomach sleeper.
No, that's a Subway sandwich.
Soft, he is 9.5 inches.
That's incredible.
Flaccid, yeah.
That's, and at some point, I mean, everything in moderation, right?
We said that all the time.
All the time.
All the time.
At some point, the high end of that spectrum, that's actually got to be a hindrance for him, I would imagine.
Yeah.
Well, and didn't we talk about earlier that he knew that he had a
abnormal
problem, quote unquote, when he was 10 during swim class. Like, everybody stared at him.
Yeah.
Correct?
He was already like 8 inches at the age of 10 years old.
Ugh.
Like,
poor kid.
Gym class,
yeah,
swimming, anything that
humiliation.
Yeah.
We can digress into some funny conversations. Probably shouldn't.
That's right.
But.
So back to, you were talking about the emotional or...
erections. Yeah. So erections can be caused by tons of stuff, right?
Right.
Oh, yeah.
He's still thinking of 9.5.
Yeah.
Yeah, so I'm like, what?
There goes your victory dance.
Yeah. Give it back.
I lost my train of thought. So erections can be caused by physical stimuli, just the act of touching. It can be caused by emotional stimuli, all controlled by central nervous system, which can be affected by both your sympathetic and parasympathetic nervous systems, fight or flight, and your feed or breathe nervous system. So it's a complex process that can start this cascade of events that cause an erection. So what causes it could be a whole host of things, but it all comes down to nitric oxide being released at some point by the epithelial cells around, in the penis. And what that does, there's another molecule called guanylate cyclase that's sitting around in there, and nitric oxide will cause that guanylate cyclase to release cyclic guanosine monophosphate, GCMP will be the easy way to say that. And that GCMP causes arterial relaxation and dilation. That arterial dilation then allows more blood flow into the penis. So the penis itself has 3 tubes inside of it, if you want to call them that, which are made up of the sinusoids. So you can think of like bubble wrap wrapped up in the shape of a penis. Instead of air, it'll be blood that's in there. Not a lot of blood. It's pretty flaccid and loose. If you increase the blood flow, it then engorges and expands like a packing peanuts sponge, whatever you want to call it. So 2 of those tubes sit on top. Those are your corpora cavernosa. And when the blood flow starts increasing to your penis, there's a tissue called your tunica albuginea that then the veins, so arteries carry the blood to the penis, the veins then carry it away. That increased blood flow will cause that expansion, and that will push the veins up against that tunica albuginea and then not allow enough blood flow out. And you're smiling. I'm
laughing because I'm thinking about, like, your knowledge base. Does it ruin other events in your life? Like, are you getting intimate with your partner and then be like, tunica albuginea?
This is my tunica albuginea?
Or does it enhance it?
I don't know.
Let's say that.
I just think about
make some phone calls.
Sometimes when you know knowledge, it ruins things. I'm just wondering, do you think about like every bodily function in the like elevated level, and then therefore nothing really is enjoyable
I can
anymore?
guarantee you that is not what's going through my head at the time.
Fun fact, the tunica can withstand 1,200 to 1,500 millimeters of mercury. It's 10 times the amount of a normal blood pressure.
So what PSI is that? Like, what is that?
29.
That's like car tire?
Car tire.
That's
tire,
impressive. Like,
blown up tire.
I drive a lot of miles on my tires. That's
Funny
pretty
story,
impressive.
I've driven a lot of miles on my tires as well.
funky today.
Yes.
Apparently this topic agrees with him.
Just happy I haven't been a victim of erectile dysfunction yet in my life.
Right.
So
right.
I'm happy about that.
So he says. So
and that's the
how do we
I'm
fix it?
to.
How do we fix it? If somebody's afflicted with it, let's just say it's not a one-time deal. Somebody now is a chronic sufferer of erectile dysfunction. What are the fixes for them?
Correct. So you've got to, so we can see the problems could be blood flow to the penis, could be, if you have the nerve problems that can't start that cascade of events, if you have nerve problems that don't allow you to feel things as you would, you've got some sort of neuropathy. So basically, you got to fix blood flow problems. You got to fix the nerve problems. One of the ways you can do it is with drugs. So I think we all have heard of the ED drugs that are out there.
Viagra.
And Viagra there was a clinical trial in '92 that was designed to improve blood flow to the heart of angina patients, and that's how they discovered, this will help. It was a side effect. It didn't help with the angina or the blood flow there, but it helped in other places.
Oh, wow. Somebody was like, I'm glad I signed up for that
Their
study.
chest pain is still there, but good God, honey.
Yeah.
It was 6 years later that Viagra was launched as an ED medication. And I also learned that, based on this literature, that the United States and New Zealand are the only countries that are allowed to countries where direct-to-consumer advertising for prescription drugs is legal.
So, you can't advertise prescription drugs in other countries?
No.
Oh.
Us and New Zealand are the only companies that
I can see that a lot of them are socialized medicine, so you don't want to. So you don't want to.
And it's pharmaceutical companies that are advertising their medications. So that's the whole pharma, big money.
Well, capitalism in medicine is a problem, actually.
Yeah.
But anyways, my own personal opinion.
So that was just an interesting side note. I'm like, interesting, because Pfizer was the one who was marketing it and came up with the study and did all this, and they're like, capitalize on it.
Well, it is true. So that's what they're doing. They're increasing the artery size, right, to increase blood flow to the heart in angina patients. And in this case, it's going to happen in the penis. But which is why you also shouldn't be taking nitrates or any of the other things that can dilate arteries and
additional
ED drugs at the same time, because it could cause a huge drop in your blood pressure.
Right. Well, and there's side effects with Viagra.
Yes.
Correct. Like any medication, a lot of them are the general. Tingling, nausea, vomiting, all these things. But there can be some pretty significant ones. So you're saying drop in blood pressure? Well,
yeah. So that CGMP, that's what's causing your arteries to dilate, right? There's a molecule called phosphodiesterase that will break that down. So then, you get constriction. ED drugs, so your Viagras, Levitras, Cialises, in your corpus cavernosa, those two tubes in your penis, the main phosphodiesterase is phosphodiesterase number 5, and that will break down the CMP. So all of these Viagras, they're just phosphodiesterase number 5 inhibitors. So they inhibit that from being able to break down your CMP, so it allows all your arteries to dilate. That's how it's working. So it's going to dilate all those arteries. Well, if you increase the size of the artery, then the amount of fluid in there is not going to cause as much pressure, so you get a drop in blood pressure. If you're also taking cardiac meds for angina or whatever, they also dilate arteries, so you can get this huge dilation and a huge drop in your blood pressure. You pass out. Bad news.
That's a bummer.
Yeah. Well, and some other complications, everything in moderation. Erections as well. If you have your erection for too long, this is a blood flow issue. You've got blood going in, not coming out. You get compartment syndrome. Compartment syndrome is buildup of acids. Can, get necrosis in there. Yeah. You can actually need to be amputated if it doesn't ever go down. Now, there are ways to make it go down. There are some people who, if they, I think all of the commercials say erection lasting longer than 4 hours, you might want to talk to somebody.
Yeah.
And I do remember in school, one particular person had that problem, and they actually came in with needles and removed the blood that way. but then he would get the red blood flow, and they had to just keep removing blood with a needle until...
Is there not like an anti-venom? Is there not like something you can that will like constrict the... I mean...
and that is a good question. I don't know if there is an anti-phosphodiesterase number 5 inhibitor. I mean, you'd have to be able to then introduce something that would allow that constriction, but the problem is it's that PDE5 in your penis itself. So what they just did was kept withdrawing the blood and allowing it to fill back up manually until the problem stopped.
Like how horrible.
Pop.
Oh.
Comes back up, pop again. And then it...
So is it risky then for, like, we'll go again with our percentages. So you have a 20-year-old who's, like, only 8% of 20-year-olds have ED. Is it risky for a healthy, non-dysfunctional penis to be introduced to Viagra? So if a 25-year-old takes it thinking it's going to improve their performance, is it risky or more risky for them versus somebody who actually has some erectile dysfunction?
The physical exchange of the molecules is going to be the same no matter what.
So they're not going to get any improved performance.
Well, they're going to get an erection, sure.
Yeah.
Or but most likely.
Most
I mean, this is percentages.
Anyway.
Yeah. So do you really need it? I mean, maybe it's going to keep you erect after climax, and so you can then continue to perform if you're in some sort of
he just wants to
multi-person environment or something, and you gotta, continue to perform.
Okay.
A marathon session, as it were, versus, CrossFit junkies. 40 years and older.
And the marathoner.
All I'm thinking about is the scene from 40-Year-Old Virgin when he's like, I was told to call if it lasted more than 4 hours. And when did you take the medication, sir? No medication taken. Just.
That's right.
So you can't help me.
Oh, that's funny.
So yeah, you can take medications, and that's what they would be doing. There are also mechanical ways. You can use vacuum pumps. Some doctors will prescribe that, but
I heard they work.
Basically all you're doing is creating a negative pressure, so more blood flow goes in there. Then you stick, the vacuum around. Got a pump that reduces the pressure. It allows the blood flow. Then you stick a little clamp at the base so that the blood can't go out. And you're just mechanically making the same thing happen.
But it doesn't seem like that would be enjoyable. Like, it doesn't seem like it would be enjoyable for the male because...
Well, and for me, I was reading on that, and bruising's an issue.
Yeah.
And to me, it's like, how did you... Whoa. I mean, bruising, like... That's kind of sore for a while afterwards for a couple days.
It just doesn't sound like it would be an enjoyable experience. I think you just probably should settle for cuddling at that point.
I don't know. Not anywhere that we work now, but prior I used to work at a sawmill, and one of my coworkers was like a true, he's like, no, it makes you larger, it's great. Sometimes my wife will just say, don't use the pump tonight. Like, it was a thing they did on a regular basis, and he worked fine, apparently. It was just he wanted to become larger, and he swore that it made him larger.
Well, and it doesn't actually make you larger. It just increases the amount of blood flow, maybe, compared to his normal.
Yeah, I don't know.
He wasn't happy with his normal 5.6 inches.
At the end of the day, your length is your length. But, so other surgery, they could do surgery, right? So they can distribute artery blood flow that way.
That seems like really risky. Like, it seems like if you get a bad surgeon, it's bad news. You end up crooked.
It's not awesome.
It seems like things could get really messed up.
They can stick some mechanical, so instead of having your natural to your, corpora cavernosa, they can stick in basically balloons in there, and then you've got a little pump in your scrotum, and you can, just like those old Nike pump shoes, you increase that. They even make adjustable ones, so you can adjust the position.
See, that one sounds like a better option to me than the external one. So at least a man maybe can still, be more discreet about it, and
And is this primarily used for people who are maybe crippled or disabled from
some sort of paralysis type of
a
situation?
It happens all a surgeon's not going to do this if you had it one time last year, let's do this. That's not going to, it's going to be, you can't do it. So you've got your MS's or your Parkinson's or your spinal cord injuries or whatever.
Right.
Let's do this. So you can still
have relationships.
Yes. So, and like, I'm just thinking Gumby, right? Like, you put it that way, now it stays that way, or, you know.
That's why I said it just seems really risky to have these types of, you know, like, what
well,
if
and then I'm just thinking, like, right? Lightning bolt.
Botched
like,
nose job.
I had a botched penis job?
Yeah, I don't know. It just sounds bad.
Yeah.
So, some of the conditions you talked about, Parkinson's, we talked about like neuropathies, like diabetic and stuff. So once you begin to have erectile dysfunction because of those, it's probably not going to fix itself.
Well, you would think maybe not. I mean, there's medications that can help with those conditions as well. Now, again, just because you have that doesn't mean you'll have this problem. Right. It's just a risk factor. But you got to imagine if your neuropathies are so bad that, you know, you can't eat soup, maybe it's so bad that you can't get that done. And once that neuropathy becomes that bad, there's no cure for Parkinson's. There's no cure for diabetes yet. There's no cure for MS yet. Especially in those MS where you don't have any nerve impulses, because you don't have the white matter to allow the nerve impulse. Once that nerve impulse is gone, it's not going to come back on its own.
Right.
So then I would imagine you'd need some sort of surgery or some sort of fix, and maybe that would be my first call to the doc.
Yeah.
I don't know.
I'm seeing two different groups. I'm seeing the medical reasons that are out of people's control. You know, people don't make bad lifestyle choices and end up with MS or Parkinson's.
Okay.
And then there's also the people that drink too much, that use drugs, that, you know, maybe have different, you know, bad habits, not sleeping well, things like that. So it just seems like there's two different reasons. So there are some that you could make changes and possibly improve.
Yeah, like type 2 diabetes, right? You know, everybody knows obesity is the number one cause of type 2 diabetes. You reduce your BMI and magically your type 2 diabetes can go away.
Interesting, though, because not many doctors will, like, and maybe your penile function will improve. Like, it just seems like there's, like, benefits to it. We say, oh, you'll lose weight, you'll feel better, you'll sleep better, all that. But maybe if they threw that one in there, maybe there would be less diabetic.
I'm on it, doc, then. Let's do this.
That one I'll work for.
I just heard a study, actually, that, and I can't remember, it was an obscene percentage of the people in the U.S. now that have, like, pre-diabetes or, like, that aren't even diagnosed yet. It was, like, 80%.
Yeah.
Like, it was obscene. But
we do have an obesity epidemic. It's over, I think, that from 88, I don't know if it's the same one, but just in other classes we've taken, since 88 till now, it's increased almost tenfold. So it's huge as far as obesity goes.
Yeah, it's our society, it's our culture. Like, for example, yesterday we all ate out and, you know, at a pretty well-known restaurant and stuff. And it was funny because they were kind enough to put calorie, carb, fat, all of that. But even the healthy section, even the salads.
Yep, I saw that.
Like, huge amounts of fat and calories in, like, a chicken garden salad, you know, and it was like an obscene amount of calories, like 900 calories and huge fat, like, you know, like half of what an average person my size would take in for the day, you know, and that was a salad. That was the healthy option. So I think that's just the way we live anymore. Like, that's our normal, you know, everybody eats that way all the time, and we're all fat.
It is. Calories in, calories out.
Yeah.
Everything in moderation.
But then it begins to affect the penis, and now we're taking notice.
Now we've got a problem.
Oh. So we know that there's Viagra for men, but there's rumor that there's Viagra for women as well.
Well, and I'm curious about that one too, because I haven't actually looked up studies on, you know, does it help with women as well? I mean, the same thing is going to be happening, right? Artery dilation. Now, I do happen to know a lady who might be dating right now who said she tried it once and it did absolutely nothing for her. She said
did
it was
she have a healthy balance
normal,
before?
Healthy, balanced sex life before, so it didn't really, she said, I didn't notice a thing.
Right. So I guess my question, my hint to that is, when a man takes a Viagra, does it actually increase their desire?
No, so
or
again,
does it just change the function?
All it's doing is changing the mechanical action of increasing blood flow, which then in turn will put pressure on the veins to decrease blood outflow, and you get an erection.
Gotcha.
It is basically blowing up the balloon is what you're doing. Using molecules, in this case, phosphodiesterase number 5, so that you can decrease the CGMP.
Gotcha.
My dad has a gentleman that comes into the store. He's older, like in his late 70s, 80s, and he was telling my dad that he met a woman and she's not even a one pillar. And he's like, what? He's like, you have the ladies that are one pill and some are two pills. And he's talking about Viagra.
Oh.
So he met a fox.
Okay.
Not even a one pillar.
He doesn't have to burn through a pill.
So his prescription lasts longer.
I'm going to start, making that joke, she has one pillar. No pills.
That's way better than the cracker analogy.
Yeah, I think so.
Way better.
I think so. That's funny, though, that's so normal to him.
Oh, yeah. My dad was slightly shocked.
Yeah, yeah. Especially in your dad's workplace. That's a funny place to...
Well, he just interacts with the public anyways, but he's created a friendship with this older gentleman that comes in.
I just think that's... Yeah. Can we say what your dad does for a living?
Oh, sure, yeah.
He's a butcher, so it's just funny to me that he's, yelling across the meat counter about his...
about his meat.
The irony there is huge.
So many jokes.
Well...
So that's erectile dysfunction.
Very good.
Very
so we know that it's mostly caused 90% of the time by some sort of a medical condition.
Medical problem.
Some that can be addressed and habits change. Some that people can't do anything about.
So you got to go have some surgery or just live with it.
All right.
Speaking of surgeries, in the early 1900s, John Brinkley became one of the richest doctors in America. He claimed that he could cure impotence, infertility, and other sexual problems by surgically implanting goat testicles into man's scrotums.
Were they connected to anything, or did they just throw them in there like a couple marbles?
This guy never graduated medical school.
Shocker.
Now, why would he use goats? Because, I've never actually seen goat testicles.
I wonder, where they were they're easily to come by because they are always, castrating goats, and they're just I've got extra. Do you want them?
Because to me, if you're going to get a surgery, this is the penis surgery, right? You want a bigger one. So, give me the elephant scrotum.
I wonder why anybody would believe that would work.
I don't know. He practiced osmosis, with an undergraduate license in Kansas. Many of his patients died.
Infections and such.
Eventually, he was sued for malpractice and forced to declare bankruptcy.
Oh. It's a shocker.
Wah, wah.
What a bummer.
Well, and if you're going to be the guy that is creating, doing malpractice in medicine, why on balls, really? Why not do something cool on breasts or something,
I don't know.
So it's just...
I'm just trying to figure out, what patients, volunteered for...
Well, obviously desperate patients.
Right. Clearly.
Well, I guess I would be desperate too at that time. That we didn't have Viagra back then. What can you do for me, Doc? Here, have some goat balls.
Yeah,
okay.
Maybe it seemed natural. Maybe it seemed okay. I don't know.
Did they take out the old ones and put in new ones, or did they just add and so now you have four?
The history buff.
Is it sack of marbles situation?
I don't know.
Just fun facts is all.
Fun facts.
All right.
Well, good.
John R. Brinkley. Look him up.
All right. Well, if you liked what you saw or heard today, check us out on YouTube or a podcast.
Or visit our website, medicalconfessions.com.